measuring tape, and you want one that measures in centimeters. Now, a normal head circumference in an infant is about 33 to 38 centimeters. And what we want to do is we want to place the tape measure around the largest diameter of the head. So to do that, we're going to place it a little bit above the eyebrows, and then we're going to wrap that around and place it around the most prominent part at the back of the head. So let's do that. So gently just lift the head up and put the measuring tape behind it. And then pull your measuring tape around. Move his head a little bit. And let's see what we get. And his head circumference is about 37 centimeters. To measure chest circumference, you want to get your measuring tape. Again, you'll be measuring this in centimeters, and you're going to take it and use the nipple line as your guide. So you're going to wrap it around there and then measure it. And his is about 36, and this should be about 1 to 2 centimeters less than what the head circumference was. To measure length, what you want to do is you want to lay the baby on a surface that you can mark. You'll need a pin for this, and you may need someone's help to help you measure the baby, because you're going to measure from head to heel. So lay the baby back. You'll want to put their head midline like this, and then just mark their head. Then you want to take the leg and extend it outward like this. Make sure it's nice and extended. You may have to work with them a little bit, and then mark it at the heel. And a normal length in an infant is about 18 to 22 inches. whenever you place a finger or you stroke the inside of the infant's palm. And whenever you do this, the hand will close around it. This tends to disappear around about 4 to 6 months of age. Then we have the plantar grasp, and plantar deals with the foot. So you get a response from the infant with this whenever you place a finger underneath the toes. And whenever you do this, the toes will actually curl like they're grasping the finger. This disappears around about 9 months to 1 year of age. Next is the Moro reflex, and this is also sometimes called the startle reflex. So this is seen when an infant hears a sudden loud noise, they will do this reflex, or if they experience an unexpected movement, like if you go to lay them down and you lay them down where they're supine and you're supporting their head and their head's just a little bit lower than their body, and you lay them down on a surface, they will do this reflex. So what it looks like is that the infant will throw out their arms, hence extend them, and the palms will be upward. Sometimes they'll move the arms back to the body after doing this, and they may even cry. And this reflex tends to disappear around about 6 months of age. Then we have the rooting reflex, and this is seen when the infant's cheek or side of mouth is stroked. The head will actually turn towards it, and the infant's mouth will open in an attempt to suck. So this reflex is really helpful in helping the baby find their food source when they want to feed, and it tends to disappear around about 4 months of age. Next is the sucking reflex, and just like the rooting reflex, the sucking reflex helps the baby feed. It's going to play a role with nutrition. So you will see this whenever something touches the top of the infant's mouth on the inside. It's specifically that hard palate of the mouth, so the roof of the mouth. The infant will actually automatically just start sucking. Then there's the Babinski reflex, and this is seen when the bottom of the foot is stroked from the heel upward along the outward part of the foot. So what's going to happen with this, you will see the big toe dorsiflex, so it's going to bend backwards, and the other toes are going to fan out or spread out. And this is what you want to see in an infant. The next is the crawling reflex, also sometimes called Ballard crawling reflex. And how you get a response out of an infant with this is that you place them on their stomach and you apply pressure with your hand to the sole of the foot. So whenever you do this, the infant will attempt to push against that hand with their foot and move the arms and legs in a crawling-like motion. And this tends to disappear anywhere between a few weeks after birth to a couple months. Next is the step reflex, and just as the name of this reflex says, this deals with the infant taking steps. So this is seen whenever you hold the infant upright with the legs and the feet touching a surface. The infant will actually move the legs like they're taking steps or walking. And this tends to disappear anywhere between 3 to 4 months of age. And lastly, we have the tonic neck reflex, and this is sometimes referred to as the fencing reflex, similar to how those people look whenever they're fencing. And this reflex tends to disappear at about 4 months of age.